Welcome to this educational video by the EBMT Nurses Group. It is intended for nurses and healthcare professionals working in the field of stem cell transplant and cellular therapy, and may also be shared with patients and families. This video explains the safe insertion and management of peripherally inserted central catheters, or PICCs. These devices provide reliable, long-term venous access for patients requiring frequent or continuous intravenous therapy, such as chemotherapy, antibiotics, parenteral nutrition, or blood sampling. Before proceeding, first verify the patient's identity and assess for contraindications such as too small veins, active infection at the insertion site, thrombosis in the selected arm, or significant bleeding disorders. Using real-time ultrasound guidance, identify an appropriate vein, typically the basilic, brachial, or cephalic vein. Since PICC insertion is a sterile procedure, wear sterile gown, gloves, and a sterile sheet to cover the patient for at least 80%. Clean the skin with an antiseptic solution. To reduce discomfort, a local anesthetic may be used at the insertion site. In adults, this is usually a small injection of lidocaine under the skin, and a topical anesthetic can be applied beforehand if needed. In pediatric patients, sedation and analgesia may be used. Under ultrasound guidance, insert the introducer needle into the selected vein, thread the guide wire, then dilator, and finally the catheter until the tip sits at the cavo-atrial junction, where the superior vena cava meets the right atrium. Remove the introducer carefully and confirm tip placement using intracavitary ECG or X-ray depending on local protocol. Secure the catheter using a fixation device such as StatLock or Securacath and apply a sterile, transparent dressing. Label the dressing with the date of dressing change. Flush all lumens with 0.9% sodium chloride using the push-pause technique. When the PICC is not in use, it must be flushed weekly to maintain patency. Never force a flush if resistance is encountered. This could indicate an occlusion. Be aware of possible complications. Infections may present with redness, pain, discharge or pus, or fever. Occlusion can result from clots or kinks. Thrombosis may cause swelling or discomfort in the arm or neck. For suspected blockage, follow your institution's protocol, which may include urokinase administration or imaging. Choosing the appropriate catheter is essential. Single-lumen PICCs are generally used for standard therapies. Double or triple-lumen catheter allow simultaneous administration of incompatible drugs or concurrent infusions and blood sampling, although caution should be taken to pause infusions whilst taking blood samples to reduce the risk of contaminants or dilution. Catheter size must be matched to vein diameter and the patient's clinical needs. Use minimum 10 ml syringes in small catheter sizes to ensure the catheter is not exposed to undue pressure. PICCs can be used for blood sampling. Always use aseptic technique and flush before and after taking samples. If blood cannot be aspirated, investigate for occlusion, catheter migration, or displacement before using the catheter. Before discharge, educate the patient and their caregiver. The dressing should be kept clean and dry. Patients should avoid excessive arm movement or heavy lifting and monitor for signs of infection or complications. Explain how and when to flush the catheter at home and ensure they know who to contact in case of problems. Many thanks for watching this video. Please contact us at EBMT if you have any questions.